Who are these spots or these little pimples down there? Well, this is known as Fordyce's spot or Fordyce's grains. These are small bumps that appear on the body of the penis. They can also appear on the lips of the vagina, the scrotum, or near the lips of the mouth. But they can have a red, pale, yellowish, or even skin color. Fordyce spots are also known as sebaceous prominence. This is very common in men and women, and there are many concerns because they think it's a sexually transmitted disease. Well, let me clarify that it is not a sexually transmitted disease. It is not transmitted, nor is it contagious. These spots are harmless, but they can cause concern because of their appearance. But these spots pose no health risk. It is only a cosmetic issue that may bother many people. Fordyce spots are a type of sebaceous glands that can appear in unusual places on the body. These are known as ectopic sebaceous glands. Some studies have linked that Fordyce spots or pimples appear due to hormonal changes, and another that they begin to form when the embryo is forming. Dermatologists say that this is more of a cosmetic issue and that it is not related to a sexually transmitted disease or the human papillomavirus. To none of this. These Fordyce spots or bumps can measure between 1 to 3 millimeters. Fordyce spots or bumps do not cause pain, they do not itch. It may be that if you manipulate these bumps, you can cause them to bleed. As we discussed earlier, although the cause is not known, it affects all types of skin. These Fordyce spots or bumps are much more common in men than in women, and are much more likely to occur in people who have oily skin. Sometimes these Fordyce spots can appear around the eye or mouth and are usually associated with a known disease. Hyperlipidemia is high levels of lipids in the blood. In other words, high levels of fat in the blood. And you might ask, is it necessary to treat them? Will they cause me any problems? Well, let me tell you that it's not necessary to treat it. As I told you before, it's not a sexually transmitted disease. It's not an infection. It's only treated for aesthetic purposes because of the appearance it presents. There are treatments to deal with these spots, but we always have to remind patients that the treatments to eliminate Fordyce spots or pimples are aggressive. Therefore, it's not usually recommended as acids are used. And this needs to be monitored by a doctor and not done by yourself because obviously you can cause other injuries. As we were saying, these are benign asymptomatic lesions with no ability to cause a health problem. There are patients who want to remove it more than anything because it appears around their lips, on the top, on the bottom, and this sometimes aesthetically does not look good and usually bothers the patient. Which, there are treatment alternatives, such as using acids with salicylic acid, trichloroacetic acid. It is applied as a form of peeling in the affected areas. But beware, you should not do this yourself because you can cause burns and you can worsen the injury. It can also be treated with biotherapy or with CO2 laser. However, I must tell you that if you do this treatment, it is not definitive because they can reappear. So now you know if you are bothered aesthetically by how it looks, you can go to your trusted dermatologist, Dr. David Campos. Thank you.